Welcome, everyone. We'll get started shortly. Okay, welcome everyone to the March 2024 edition of Green Infrastructure, Climate and Cities. This is a monthly seminar series focusing on the unique challenges that climate change pose on cities and what we can do about it. I'm the director of Drexel's Sustainable Water Resource Engineering Lab and a co-PI on CC Run, the NOAA-funded team that brings you this seminar series and has been around since 2014. All of our previous seminars are live cast and recorded and archived on the CC Run website, which is recently redone, and we invite you to go there and check out any of our previous webinars. You can also go to the CC Run YouTube channel, and as most of you know, continuing education credits are available for professional engineers and architects as well. As a reminder, during the webinar, use the Q&A box to submit questions, and I'll be facilitating a Q&A after each of the two presentations that we'll have today, and only reserve the chat, use the chat just for logistical questions you may have. We could go to the next slide, please. This is a quick public service announcement on this rainy day in the Northeast. With funding from the National Science Foundation, some colleagues and I developed a new app that allows users who subscribe to storm drains to get announcements of forecasted rain. And the app is called CleanLet, and you can download it by scanning this QR code on this slide. It's available at the App Store and the Google Play Store. Once you download the app, you can register an inlet that you care about. And once you've registered the inlet, you can subscribe to it, and you'll start getting push notifications when it's about to rain. And that will give you the option to go clean. And if you prove that you've cleaned the inlet by taking a photo before and after the cleaning, you'll get points. And those points can accrue over time. And this is a way of crowdsourcing inlet cleanance to reduce flooding. Just wanted to make that public service announcement. Let's go to the next slide. And with that, I'll introduce the third and final session of our collaboration, that is CC Run's collaboration with the New York City Panel on Climate Change. Ahead of the NPCC's release of its fourth assessment report, we've been using the past few CC Run seminars to introduce some of the major chapters in the forthcoming assessment. And so today, our speakers are going to be talking about climate change in New York City's health and energy and security risks. If we could go to the next slide. We have a number of amazing speakers with us today here to present on health. I'd like to welcome Tom Mattei from Columbia University, Dr. Kim Knowlton from Columbia University, Jenna Tipaldo from the City University of New York, and Katie Lane from the New York City Department of Health and Mental Hygiene. And then next, to present energy and security, I'd like to welcome Dr. Liv Yoon from the University of British Columbia, Jen Ventrella from the New School, and Dr. Peter Marcotulio from Hunter College. So I want to just thank all of our speakers for joining us today. If you go to the next slide, this is a look at our agenda. We'll wrap up the presentations with a general discussion and Q&A, but we'll have questions and answers after each of the two sort of core presentations. So with that, I'd like to hand it off to our speakers. Actually, I'm going to hand it off to Tom Mattei to talk a little bit about the history of NPCC. Tom, the floor is yours.
Thank you, Franco. Thanks, everyone, for being here. If you've joined earlier CC Run presentations, you already know that Local Law 42 is a New York City law that was passed in 2012 to establish the New York City Panel on Climate Change, of which the fourth panel is just about wrapping up its work. And the purpose of it is to prepare for and to mitigate the expected impact of climate change on New York City. All of the panelists are volunteers, and we've been working busily for the last 4 years through the pandemic, and we're pleased to be nearing the finish line. Next slide, please. It's important to keep in mind that this New York City Panel on Climate Change assessment is nested, or it's complementary to larger scale assessments. So an assessment synthesizes the science and uses models to characterize and project climate risks, vulnerabilities, impacts, and options for adaptation and mitigation. And we're doing that focusing on the 5 boroughs of the city of New York. There is also a state climate impact assessment that includes a health chapter that's already available. And of course, there's the national climate assessment, which covers the country, but also has regions, and New York City is in the Northeast region. The term sustained assessment is used in some parts of the NPCC report, and it really refers to the fact that the assessment ideally should be ongoing, monitoring and evaluating climate risks, vulnerabilities, and actions that the city is taking, and how those are playing out and impacts on the city and the people of the city. Next slide, please. I just wanted to highlight here a couple of things are new in the 4th climate assessment for New York. There's a futures and transitions chapter. The health assessment will be the first one since the NPCC 2, which was released in 2015. And we are very pleased and excited that there will be, for the first time, an energy and security chapter, and you'll be hearing from the lead authors of that later in this session. Next slide, please. Okay, so there is an entire chapter and a detailed assessment on both climate change projections for the city, and you've already heard about that, and the flooding assessment. For the purpose of thinking about health, the implications for the health of New Yorkers, the key considerations are that we are already seeing warming and more hot days in recent decades, and we know these trends will continue, and that extreme heat events will become more severe and frequent in the coming decades. Rising sea levels and more frequent and severe downpours have been observed in recent decades, and a combination of these two will increase the risk and extent of flooding in the city. There's very high confidence that the city is going to be getting hotter and that sea levels are going to continue to rise that will affect New York City. And that's true even if all global emissions stopped today. So that means it's very important for the city to be taking actions to prepare for climate change that's already, in a sense, baked into the climate system. There's less confidence about the future pace and the magnitude of these changes. I think you heard about some of that uncertainty and difficulty modeling and predicting future extreme rain impacts also. So I think you heard during the earlier CC Run presentation on climate projections about some of these uncertainties and challenges in predicting tail events or extreme events. Next slide, please. So New York City's health risks is the first of the 2 parts I'll be talking with you about. So next slide, please, Janice. So an overarching key message, the health assessment has several key messages, but an overarching key message is that really climate change is a threat to the health and well-being of all New York City residents, but especially those who are most vulnerable. And the things that make people vulnerable fall into 2 broad categories. One are things about the people and their social context. So that includes things like their health status, racial and social inequities that are longstanding in New York City, and things like social isolation. But equally important, and I think hopefully of interest to the audience of engineers that I think may be watching this presentation, is that inequities and differences in household and neighborhood physical environments are an important factor in vulnerability to the way that climate impacts health in New York City. Next slide. So this graphic is an attempt to capture the complex interrelationships between the climate risks at the top, the exposures in the middle, which are the sections of the climate assessment chapter, and health outcomes at the bottom. And then on either side, you see these two broad categories of factors that influence vulnerability, including the population and social context. And then on the right side, the physical environment. Um, we've been asked to emphasize sort of what's the relevance of public health or a health assessment to people working in sectors that are not directly involved in health, but they're working on climate adaptation and other aspects of climate action. So public health science can bring to any city or jurisdiction's assessment the methods that help to characterize how the physical environment, as well as the social context, impacts the vulnerability to health impacts and disparities. So public health science has a lot of things in the toolkit that can help to really understand in a rigorous way how health is impacted by things that are under the control of other sectors, like the housing sector, the energy sector, and so forth. So through collaboration, public health knowledge can be used to inform actions in other sectors and to try to do things in a way that helps to avoid maladaptation, meaning things that might seem to be good from the point of view of a particular sector like the energy system, but could create vulnerabilities or risks for public health. Next slide, please. So the first health impact of climate health risk that we're going to talk about is heat. And for that, I'll hand it over to my colleague, Katie Lane.
Thanks, Tom. So we know that heat and hot weather can be dangerous to health. And this figure mirrors the figure that Tom was just presenting, but it shows some of the pathways through which warming temperatures and hot weather and climate change can lead to health impacts. So heat can lead to a range of health impacts, including, both direct illness from heat stress or heat stroke, where the body can't maintain a safe temperature, and that sometimes leads to death. In those cases, we have they're easier to count because heat is marked as a cause of death or of the health impact on a death certificate. But hot weather can also worsen existing chronic health conditions like heart or kidney disease, and that can also sometimes lead to death. So we call those deaths heat exacerbated deaths, and we use statistical models to estimate the number of those deaths. And so when we're looking at the pathways through which temperature can affect health, we know that vulnerability to these health impacts are really influenced by someone's physical environment, some of the personal characteristics like age, and someone's social context. So the burden of hot weather, the health impact burden may not fall equally depending on differences in some of these things for different people and communities. Next slide, please. And so just looking at the lethal health impacts of heat in New York City currently, we see on average that there are about 7 of these direct heat stress deaths a year, and about 345 heat exacerbated deaths on average every year. So you can see that there are a lot more of these heat exacerbated deaths. And just in general, already the burden of heat on health is substantial. Lack of home air conditioning is a really important risk factor. Both not having air conditioning and not being able to afford to run it. And we see that the hottest days tend to be the deadliest, but hot weather causes health impacts on a continuum. So deaths can happen on hot but not extreme heat days too. Um, and they're just over a summer period, there just tend to be more of these types of hot but not extreme heat days. We also see that Black New Yorkers are more likely to die from heat stress, twice as likely to die from heat stress compared to white New Yorkers. Um, and they also have a higher odds of death from worsening chronic conditions associated with heat. But this disparity and inequity is not biologic. It's really a reflection of structural racism across a number of systems, including housing conditions, economic opportunities, and healthcare systems. Older adults are also more vulnerable. They tend to have more chronic health conditions. As people age, they may have less adaptive capacity. There's some normal age-related declines in ability to sense thirst and to regulate body temperature. And older adults may also be more likely to be socially isolated or live alone, although there's a lot of variation among older adults. Next slide, please. So in New York City, we're already starting to see the effects of a warming climate and warming temperatures. This graph shows the annual average heat exacerbated mortality in New York City since the 1970s up through 2020. And the orange dots and lines show mortality and confidence intervals on days where the maximum temperature reaches at least 82 degrees or hotter. And the red dots and lines show heat-related mortality on extreme heat days, so days roughly above about 95 degrees. And so, we see that heat associated mortality has been decreasing since the 1970s. It kind of plateaued between about 2000 and 2010, and it's actually been increasing over the past decade. And these increases in the past decade are associated with increases in hot but not extreme heat days, those orange dots and lines there. So, at the same time that we've been seeing these the decrease, kind of the plateau, and then the increase, we've seen that the proportion of homes with air conditioning substantially increased from the 1970s to about 2000, and then it also plateaued. So we think that this plateau in air conditioning coverage, combined with kind of a rapid increase in the number of non-extreme but hot days, is probably what's driving this overall increase in heat exacerbated deaths in the past decade. And most mortality, about 2/3, happens on these hot but not extreme heat days. Next slide, please. So some neighborhoods in New York City are also more impacted by heat than others. The figure on the right is the health department's heat vulnerability index, which we developed several years ago with researchers from Columbia's Mailman School of Public Health. And it shows the differences in neighborhood level heat mortality impacts. The index includes race, income, air conditioning coverage, surface temperature, and access to green space. And we see that low-income neighborhoods that are home to people of color and neighborhoods where surface temperatures are higher are more impacted. Access to home air conditioning, higher median incomes, and green space are protective. And again, I just want to note that these differences are driven by inequities in social systems and access. So, for example, that may make people living in lower income neighborhoods less likely to have home air conditioning. Next slide, please. And I think here I will hand it to my colleague, Kim Knowlton.
Thanks, Katie. Yes, I'm going to take a minute or two to talk briefly with you about flooding in New York City and the health risks that it presents to the people of New York. Some of those pathways that Tom mentioned, Katie mentioned, by which people can be harmed before, during, and after flooding in all three of those event phases. That includes some of the ways that one might expect, like deaths from drowning or injuries from impact with windblown or water carried debris. But there are also deaths from things like carbon monoxide asphyxiation, which can happen because during utility outages that are flooding related or storm related, people without power may try to unsafely use space heaters, and asphyxiation can result. Another aspect is evacuation, which can mean disruption of healthcare for many people, people on dialysis or people dependent on other frequent health services. Pharmacies and treatment centers often close. Caregivers can't reach patients because roadways and subways are flooded. So flooding really has a whole range of these health impacts. And for sure, longer term displacement health risks as people are forced to leave their homes, that has been linked to chronic stress, to mental health challenges, economic distress, increased cognitive risks, and PTSD even. So these are some perhaps not so obvious impacts of flooding, but nevertheless very important to health. You can see that older adults are more vulnerable for a host of reasons. Older adults, of which in New York there's over 1.4 million people now, or nearly 1.4 million people aged 65 and older. A lot of New Yorkers tend to have more chronic health conditions, mobility limitations that can impact or interfere with efficient evacuation, and they're going to be more impacted by disruption of health services and care. Bringing up a point again that's really important. Katie and Tom each mentioned that the physical environment is really important in determining flood and health risks. People and places also can confer increased vulnerability to harms. So the survivability of dwellings that can be quickly reoccupied or even allow for sheltering in place, that can really be a lifeline and interrupt those health harm pathways. Survivable buildings reduce health vulnerability and really do increase resilience. Next, please. This is by now a familiar schematic, but a powerful one because it considers interconnections between the sources of flooding and the types and those human health exposures and impacts. It's worth noting that in New York City, there are actually 4 types of flood exposures that are important to health. The first is pluvial, which is caused by extreme rainfall and resulting flash flooding. We understand from 2021's Ida remnants cloudburst event how very important and how very damaging to health and lethal pluvial flooding can be. Next is fluvial flooding, which occurs when a river or stream overflows its banks. The third type is coastal flooding. It's been mentioned that that is very likely to increase in New York City as climate change continues, in part because sea levels are rising, and that tends to increase the aerial range of floods, but also storm events are becoming more frequent, the types that can impact flooding. The fourth type is groundwater flooding. That can damage sewer systems, mobilize subsurface chemical contaminants, or even waterborne pathogens and put people in contact with those. So the flooding health impacts are again very much affected by the physical environment in all 3 flood phases and by those personal and social characteristics, not only age, but pre-existing health conditions, racial, social, economic disparities, and inequities in access to healthcare, and changes or differences across the city in preparedness and response capacity. We challenge ourselves constantly to reflect on how our work in climate change affects New Yorkers' health. So we're really glad to be having this conversation with you, given your areas of expertise. With that, I'll hand it over to you, Tom.
Thank you, Kim. So I see we've had already at least one question about air quality, so I'll try to touch on that as I go through this slide. Climate change is affecting air quality nationally and around the world, but despite a warming climate, our air quality in New York City has been improving over the past 10 to 15 years because of reductions in local and regional emissions. So within New York City, the primary pollutants, things that come right out of the tailpipe, or are formed soon after emission. Like PM 2.5 is the most important for health in New York City, and it's gone down dramatically, as you can see from the map comparing 2009 to 2021 in the upper right. Nitrogen dioxide is a pollutant that is related to tailpipe emissions from vehicles in much of the country. And in New York City, it's a combination of vehicle emissions and also fresh combustion in buildings. And again, that's improved dramatically because of various national, state, and local regulations and actions. But last summer, we had really a shocking and unprecedented in recent decades increase in transported PM 2.5 from outside the city, coming from the wildfires in Canada. And so for the first time in New York's recent history, we were faced with the prospect that maybe the progress that's been made could be reversed if these types of episodes continue. Ozone is the pollutant that is most sensitive to temperature. It's formed in the atmosphere. The one thing that is a little different about ozone is that the highest levels of it tend to be downwind from the concentrations of emissions. So actually the highest ozone levels in the New York metropolitan area are outside of New York City. And within New York City, Staten Island, which is more suburban, tends to have the highest levels. So ozone, I think the question one of the people watching the talk had was, what's the pollutant most sensitive to climate? And that would be ozone. But it's important to point out that having air conditioning not only protects people from heat, but by allowing people to close their windows and turn on the air conditioning, the indoor ozone concentrations will be dramatically lower in an air-conditioned apartment. And when we have high PM levels, very high, like we had during the wildfire events, we also advise people to stay indoors when they can. But being able to do that and reduce your exposure to wildfire smoke is much greater for people who have air conditioning at home. As with other climate health impacts, older adults tend to be more vulnerable. They have a much higher rate of underlying heart and lung conditions and metabolic conditions like diabetes that make them more vulnerable to air pollution. And of course, most people are aware that children with asthma are particularly vulnerable to air pollutants, including PM and ozone. Around the city, you can see from these maps that there's spatial variability in the average exposure to pollution. So if you live near a busy roadway, you're going to have a higher average exposure to PM and NO2 when you're walking around your neighborhood or at home with your windows open. And of course, if you don't have air conditioning, as I said, you're going to have more exposure indoors. Next slide, please. So vector-borne diseases, by vector-borne diseases, we mean diseases that are carried by another, in this case, insect, another living thing that carries it to people. The most important mosquito-borne illness in New York City is West Nile virus that emerged in 1999. It causes the most cases of mosquito-borne illness in New York City. We did have the highest number of West Nile cases since 1999 in 2022, and also the most detection of West Nile in mosquito pools that the city monitors. Those numbers went down some in 2023. But like all mosquito-borne illnesses and mosquitoes themselves, West Nile risk is related to the weather, but it's also related to non-climate factors. Lyme disease is the most common tick-borne illness among New Yorkers. Most New Yorkers get tick-borne illness, Lyme and other tick-borne illness, when they're having outside activity, generally outside the 5 boroughs of New York. The ticks that carry Lyme disease are not really present in most of New York, except for Staten Island and part of the northern Bronx. If you look at the chart, and you'll see the axis for confirmed and Lyme disease cases is on the right axis, showing that it's a much larger number of cases each year than for other tick-borne illnesses. And it's important to note that over time, one of the things that drives the number of cases reported are things like changes in the case definition. So that happened in 2008 and 2022. The case definitions for Lyme disease changed and increased the number of cases, but also the ability to diagnose these diseases and provider awareness is also increasing. In addition to climate, though, changes in the local land cover, habitat, ecosystem all affect the abundance of the insect vectors that cause human disease, and then human behaviors like whether people use insect repellent when they're out, when there might be mosquitoes carrying West Nile, or behaviors to protect yourself from ticks when you're hiking in an area where ticks carrying Lyme disease are present. Next slide. There are other climate-sensitive health risks covered in the fourth assessment. We call them climate-sensitive, meaning that climate and climate change affects them, but it's not the only factor affecting the risk over time. So pollen and other air allergens, we do know that nationally, climate change is causing earlier, longer, and possibly more intense plant pollen production seasons. Within New York City, pollen particles tend to be fairly large. They don't travel long distances like PM 2.5 combustion particles do. So the local exposures have a lot to do with local trees and other vegetation that produces allergenic pollen. So that's something that can be modified by changes in tree planting practices that the city is already undertaking. Another thing that influences vulnerability to allergic illness is how much asthma there is in a different community and how good the care and control of asthma is based on access to good health care. And then there are factors in the home environment that influence the severity of asthma, like the presence of insect pests like cockroaches and rodents. Waterborne pathogen exposures can also increase because of climate change. So most obvious is when we have an extreme rain event that causes flooding, sewer backups into basements that can just expose people directly to untreated sewage, or what's called combined sewer overflows that can release untreated sewage into the surface waters around the city. An important waterborne pathogen for New York is Legionella. So with rising temperatures, the growth of bacteria that cause Legionnaire's disease increases. And this is a disease that's more likely to cause severe illness in older adults. New York City has a large number of cooling towers on the top of its big buildings that are used to help with air conditioning. And when these are not properly maintained, they can release an infectious aerosol, causing local outbreaks of Legionella disease. And Legionnaire's has been rising across the country, really, but also in New York City. The final type of climate-sensitive health risk that we cover in the fourth assessment are what we call compound risks, and these fall into two broad categories. One is when extreme weather causes another consequence, like disruption of lifeline infrastructure, like a power outage or damage to health facilities and so forth, as Kim was describing with flooding. The other type of compound risk we experienced during the recent pandemic, when we had COVID-19 circulating during hot weather. And so that complicated efforts by the city and by individuals to find a cool place to shelter from the hot weather because of the risk of transmission in public cooling centers. Next slide, please. So with that, I'm going to hand it off to my colleague, Jenna Tipaldo, to talk about demographic futures and the rest of the talk.
Thanks, Tom. We heard a bit from Tom, Katie, and Kim about how older adults are more vulnerable to a variety of these climate hazards. So in general, the age composition of the city plays a role in our vulnerability to a variety of climate hazards. We heard about how older adults and children have increased susceptibility to impacts such as heat and flooding. For older adults, this may be because rates of chronic conditions increase with age, as might susceptibility to infectious diseases. In the coming decades, New York City is projected to have a higher number and proportion of adults over 65, although New York City is not quite aging as fast as the rest of the country and surrounding areas. Compared to rural areas, urban areas like New York City are more likely to have older populations that are from historically disadvantaged or immigrant backgrounds, which can compound vulnerability. And in addition, factors like household structure, living arrangements, and social connections, as opposed to social isolation, can compound someone's vulnerability to these climate hazards. Next slide, please. So to reduce future health risks, messaging and communication are important. Climate risks may vary between and within communities across demographic groups, so clear and actionable communication tailored to specific groups is essential. On the right side of the slide, you can see that there is a table that has some examples of actionable messaging to reduce exposure to various hazards, like turning on your air conditioner or going to a cooling center during a heat wave. Like we heard from Kim earlier, if there's a flooding event, if it's something like a hurricane, you might be asked to evacuate ahead of time, or if there is a rainfall event, you might be asked to move to higher ground and shelter in place. There might be other messages depending on the hazards, and especially if you have compound hazards, like Tom mentioned, clear messaging is very critical. So information access is important to consider, especially in a city like New York, where we have people who speak many languages and may have varying degrees of access to and comfortability with technology. Furthermore, healthcare providers, we'll hear more about their role later, are critical to help reach vulnerable populations, such as through patient counseling and connections to resources. Engaging communities will also be very important in developing messages and increasing risk awareness. Next slide, please. So health needs are connected to the built environment, including addressing opportunities for cross-sectional collaboration that engages public health through things such as the housing and energy sector. So efforts to reduce emissions, such as phasing out fossil fuels, can have health co-benefits such as reducing air pollution. Residential cooling is really critical for health, as we heard already during extreme heat events, as Katie mentioned, and during air pollution events like Tom mentioned. And it's important to consider access and affordability in addition to more engineering concerns like grid capacity, as we'll hear more about later from our energy and energy insecurity chapter. So regarding flood risk, why people live in vulnerable housing, such as basement apartments that we saw flood after Ida in fall 2021, or housing in flood zones, which we saw flood and during Sandy. This may be connected to housing affordability, which may be needed to address with policy intervention. So housing concerns are also connected to building systems and infrastructure that can help mitigate risks and impacts due to flooding, such as elevating utilities and implementing green infrastructure and roofs. Next slide, please. So there are some gaps in knowledge regarding how to reduce future risk. Regarding emergency responses to heat and storms, there are challenges around getting people to centers, such as cooling, warming, and evacuation centers. And these include things like mobility needs, people feeling reluctant to leave their homes, or just a general lack of awareness of these centers. So since cooling is so critical to health in extreme heat, policy interventions such as preventing utility shutoffs or disconnections during heat waves can help mitigate this health hazard. People can be exposed to climate hazards in their homes, but also at work. So occupational health protections are also of a concern. And building on existing guidance around exposure to heat will be important. There are some gaps in national standards, such as those set by NIOSH. And in terms of the public realm, policy and government interventions will be important to reduce things like mosquito-borne illness and minimize exposure to heat. And as Kim mentioned, the physical environment plays a huge role in flood risk. So we have an example here. Street trees can provide shade and a cooling effect during heat waves, but they can also be impacted by precipitation. And if you have trees, they should be adapted to climate changes, such as in temperature, precipitation, and even salt tolerance in areas that may flood with seawater. Next slide, please. So this report, as Tom mentioned in our introduction, is designed to be policy relevant. So here are some examples of some components that can play a role in mitigating health impacts. So some housing policies and investments that advance adaptation. So things like expanding that residential cooling access, some flood protected building mechanical systems, energy backups, affordability, reliability, and access. Things like window screens, air conditioners that may impact your temperature indoors or also your air pollution indoors, as well as things like affordable housing to provide alternatives to things like flood-prone basement dwellings. In terms of community engagement, doing things like strengthening community social networks, cohesion, and engagement in planning and response can be really important. And the Department of Health and Mental Hygiene in New York City operates a community outreach program called Be a Buddy that helps pair younger people with older adults and help to reduce heat risk in some of those vulnerable populations. So in terms of communications, it can also be helpful if we improve and evaluate communication strategies to promote awareness, preparedness, and timely response to warnings, which can be so critical to reducing health impacts and saving lives. Next slide, please. So healthcare providers will play an important role in reducing future risk. Healthcare providers can help identify and counsel vulnerable individuals. They can help prevent heat-related illness by tailoring strategies to specific groups. So older adults or workers or athletes are some groups that may be vulnerable to heat, but in different ways. And there may be different strategies helpful to people who identify with any of these identities. And tailored education and some anticipatory guidance to patients, caregivers, coaches, employers, and really just getting information and awareness about ways to recognize illness, prevent illness, and prepare for these increased health impacts related to heat that we anticipate and actually are already seeing, as Katie discussed. Furthermore, the health impacts related to climate change are being incorporated into the medical curriculum. So getting some training for healthcare providers so they are prepared and know what to do to help reduce some of these risks. The American Medical Association and some medical schools now host some curricula, but more work is needed to engage other types of healthcare workers that have direct patient interaction and really are on the front lines of interacting with people to help reduce this risk. And finally, healthcare providers can help with advocacy. So advocating for things like affordable, climate-safe housing, communities, and energy services. Next slide, please. So there are some key gaps and research needs that we've identified in general regarding how climate change will impact health and specifically in New York City. So there's definitely a gap with the knowledge of how indoor temperatures relate to health risk in different types of structures, as well as some of the relationships between heat and humidity under changing climate. We know New York is more of a humid city. Another key gap in terms of social determinants of health is the impact of social isolation on a variety of climate hazards. Social isolation is hard to measure. It's not really standardized or collected through the census or other health surveys. New York City has a community health survey that does not have a question on it. And social isolation can impact people's network, ability to get resources, and ability to get information and be prepared for health impacts as well. Another gap that we identified was the spatial distribution of social and housing vulnerability to flooding, including the location of basement dwellings. This is something that is a key risk factor, knowing that there were people that drowned in their basement dwellings during Ida. And then another final gap was we need some more research on the most effective risk communication approaches for New York City's diverse populations and communities, knowing that we have people in New York City who speak dozens, if not hundreds of languages. And we may have older adults who may be socially and or linguistically isolated. And I believe that is the end of our slides. I think we'll be taking some questions now.
Great, thanks so much. There was a lot in there. So I welcome everyone who hasn't already and has some questions to add them to the Q&A. We have a few questions in there. I'll sort of kick it off. I was struck with that slide that showed deaths due to heat in the 1980s through the present. I think it was starting in the 70s to the present, and there was this sort of reduction in the 80s, which I think, if I understood correctly, the presentation was sort of attributed to increase in uptake of air conditioners, which I think, Tom, you said also not only protects against health, but also protects against ozone. So that was kind of really interesting to me. And I'm curious, there's a question about natural gas stoves. And I guess with an air conditioner comes less circulation of exterior air. So I'm guessing that the reduction in depth suggests that on balance, the impacts of heat and ozone are more negatively buffered than indoor air quality. But I wonder if you could say anything about indoor air quality as a result of higher air conditioner use.
Yeah, I mean, just in general, indoor air quality, you can think of it as being related to the source, what's being emitted, like smoking, certain types of cooking. Anyone who has ever set off a smoke alarm, broiling a steak or something like that, or fish, knows that smoke can be produced. PM 2.5 particles can be produced by all kinds of cooking. And if you have windows closed or you don't have exhaust fans in the kitchen, the air exchange will tend to trap those pollutants indoors. Gas stoves, it's a little more complicated than some of the news coverage, I would say. There's been a lot of misinformation on all sides of the issue, but basically, it's definitely the case that when you have a gas stove without good ventilation, it will increase the levels of NO2, is the main pollutant. If the stove is working properly, CO poisoning shouldn't be an issue. And it's also very clear if you replace gas stoves with electric induction stoves, which are very efficient, that the NO2 increase will not occur when you're cooking. The evidence, direct evidence that if you replace gas stoves, that health will improve is more limited. But it makes sense where it can be done for a lot of reasons to replace it. However, one of the barriers is there are a lot of misconceptions about how it performs as a cooking method compared to gas. And anyone who's used an electric induction stove properly will tell you it's actually better than gas. It's more responsive, it's instant on, it's instant off. So the other issue that people are concerned about is obviously methane and its effects on climate. And it's true that leaks of methane is a potent greenhouse gas, but the amount that comes from stoves is quite small compared to the amount that's used in heating. So I think, you know, the long and the short of it is it would be good to replace gas stoves when it's practical and to alert people to things they should be doing. If you turn on the air conditioner and you light up, you know, cigarettes indoors, and you have other things that are producing pollutants indoors, that's not necessarily going to be a net plus.
Yeah.
Air conditioning, though, I will say, the evidence that air conditioning has played an important role in reducing heat health impacts in the US, I think it's pretty overwhelming. And just as an aside, people who are interested in the question, what will using more air conditioning or making it more available do to greenhouse gas emissions in New York City? There is a section in the Futures and Transitions chapter of the assessment that deals with this question.
I'm wondering if you can, is there a spoiler you can give us on how that, you know, where they land with that?
Well, basically, the amount of emissions from residential air conditioning in New York today is a relatively small share of greenhouse gas emissions. Much more comes from heating, and that will be true for a long time, even under warming. Much more, probably about twice, I think, the share of emissions from cooling come from commercial buildings, not residential buildings. And then another point is that we know that the thermostat setting on an air conditioner will have a lot to do with how much energy it uses, and that there's a lot of wasteful air conditioning use in New York City. Anyone who's worked in an office where people are using space heaters or bundled up with sweaters and shawls in the middle of a hot summer day knows that to be the case. So it's right for people to ask the question, but I think if people understand, you know, where it fits in and what is required to just increase that access to the remaining vulnerable population. So 80 to 90% of households in New York City already have air conditioning and have for a long time. Most people who are upper middle income, affluent people can afford to pay their electric bill and run their air conditioning whenever they want. But that's not true for the low income population. So I would say the short answer is there's no reason why we cannot make air conditioning universally accessible and affordable for vulnerable people in New York City without increasing emissions at all. And there are many ways that we can offset whatever emissions are required to fill that gap in air conditioning that would you know, distribute the burden of adaptation to populations that use a lot more energy in New York City. That's a little more than a quick preview, but thanks for asking the question.
No, thanks. That's really interesting. And I guess let's move on to a series of questions about trees, which were brought up. And I know from work in green infrastructure over the years that there's been a lot of research on the sort of location of trees and different types of trees, and some trees release allergens. Alex points out that some trees release ozone. How do we think about them as filters? I mean, is it possible that are they always filters, or are there some configurations of, like, you know, trees holding automobile emissions closer to the sidewalk and making conditions actually worse for pedestrians? Or what are the nuances in trees as air filters?
Yep. So trees do trap some PM, especially PM10, but the amount that they can remove is quite small relative to the local emissions. So that function that trees have will never really give us the kind of clean air we want if we don't reduce emissions. And furthermore, as you mentioned, Franco, it is true that if you picture some of our lovely residential streets with nice tree canopy arching over the street, if you have idling vehicles on that street, that canopy will reduce the ventilation and can increase the concentration. But in other configurations, let's say you live near a busy freeway, if there is a barrier between you and the freeway, a planting of some sort, that can help to divert the stream of pollutants, the plume of pollutants coming out of the tailpipes somewhat over and disperse it. So if you're walking very close to a freeway, you know, you might not have as much exposure. So trees have a lot of other benefits. I would say in terms of health, the biggest benefit really is providing shade and a comfortable thermal environment. And their influence on air pollution is more complicated.
Thanks. Moving on to oh, go ahead.
Could I,
Go ahead, Kim.
Franco and Tom, yeah, it's Kim here. I just wanted to add on the question, Tom, I think you were talking about particles, but on the ozone side, trees can emit ozone precursors, but they don't emit ozone directly. Ozone is at the ground level, is formed in the atmosphere, and it can be a really complicated chemical reaction that forms ozone. So while trees can be and are sources of ozone forming chemicals, they're not sources per se. And so it is, again, sort of along the lines of what you were saying, a bit complicated. Trees provide shade, which is incredibly important and beneficial to health, but they can also be sources of the precursors of ozone.
Right. Excellent point. Thank you, Kim.
Thank you, Kim. There's a question by Clement that's sort of on the governance side of thing, and it's about the role of the city's health department in climate-related public health issues. And specifically, the question is whether the health department can mandate healthcare providers to provide data on climate-related health issues, or I'm sort of extrapolating the question into other dimensions of what can the health department do about climate change specifically?
Well, maybe I'll start, Katie, and then hand it off to you. So the health department makes use of a lot of data that's generated by the providers in monitoring the impacts of climate on health. Looking at heat-related illness, for example, from emergency departments. The question of reporting for communicable diseases, absolutely, providers are mandated, and they do report these climate-sensitive diseases like Legionella, West Nile virus, and tick-borne illness. Mandating other kinds of reporting is more complicated. I think there are providers are asked to report deaths from heat-related illness. If I have that right, Katie, but why don't you take it from there?
Yeah, no, thanks, Tom. And yeah, as Tom mentioned, there are several communicable diseases that are reportable. We get the health department collects data on all deaths in the city through our Bureau of Vital Statistics, and so we can look at our medical examiner investigates every type of death that is an external cause of death, so something that's not caused by like a disease process, or that is it's unclear what caused the death. So they will investigate and certify heat stroke deaths when that is suspected. But because we know it's really hard for clinicians to recognize and flag heat as a potential contributing cause of death, we do also take all of that vital statistics data on every death in the city and do these statistical calculations every year to look at the burden of basically excess mortality caused by heat. And that actually, the health department puts out a report on that every year, which is something that's mandated by city council. So that's, there are some rules governing that, just as we do. The health department also puts out a report every year on air quality in New York City. So in addition to just providing information about exposures and health impacts, another thing that the health department can do is work with providers, putting out health alerts to medical providers to prepare them for expected things like we put out a preseason alert every year about what providers can do to help their patients prepare for heat. And also we put out health alerts during emergencies. And so there's we also have a large group that works with the healthcare sector and hospitals on a variety of issues, including weather and climate preparedness. And then I would say the third thing that we do is we work really closely with other agencies, and especially our Mayor's Office of Climate and Environmental Justice, to try to provide health information and a health perspective into citywide climate mitigation and adaptation planning, because we're one piece of the puzzle, and I think a lot of the presenters here kind of talked about the ways in which health is impacted by so many things, including the physical environment, social processes, a lot of things that are kind of outside of the direct control of the health department, but we can bring the health perspective to other agencies that are working on housing or building policies. And so we work closely with our partners and with our mayor's office.
Thanks so much. I think we're going to have to move on to the second presentation. I know that there are a lot of questions that sort of appeared during the Q&A. If any of the health speakers want to type responses to those while we move on to the energy presentation, please do. Otherwise, we'll get to them at the end after we have the energy presentation and the Q&A for the energy presentation. So with that, I'll hand it over to our next cluster of speakers.
Great. Thank you, Franco. I'm happy to open this section about energy and energy insecurity and health. As Tom mentioned at the opening, this is the first time that energy insecurity and health are included in an NPCC assessment. In short, our chapter outlines the state of energy needs and transition in New York City and state, while also emphasizing the need to keep energy insecurity and health in mind during this transition process. So us three lead authors of this chapter, myself, Jen, and Peter, will take turns presenting the highlights from this chapter. Next slide, please. So there's zero doubt that we need an energy transition, but the premise of our chapter is that while this is of course true, energy insecurity and health must be considered in this process. And I'll define what energy insecurity is soon. We're expecting more extreme weather, so big storms, heat waves, as the health group just mentioned. This means more demand on our energy systems, whether it be to keep your homes warm or cool. This all makes it harder to keep the lights on and homes heated, homes thermally comfortable, the more demand on the energy systems. And as we move away from fossil fuels to low carbon electricity, our grid systems are going to be under a lot of pressure, which of course threatens reliability. And when energy systems do get hit, it's often the people who are already marginalized in underserved communities who feel it the most. So a successful energy transition isn't just about being green, it's also about securing justice by ensuring affordability and reliability for everyone, especially those in underserved areas. I'll let Peter now to speak to the state of the energy transition in New York.
Thank you, Liv. So, as touched upon by the health group and as sort of summarized by Liv, for many climate impacts, individuals from underserved communities are more highly exposed and more vulnerable to climate impacts than individuals from other communities. We've heard that, for example, Black New Yorkers are twice as likely to die from heat as white New Yorkers, for example. In regards to energy, underserved communities also face dual challenges. Not only climate change and climate change impacts on energy, but also the energy transition in and of itself. So on the one hand, climate change impacts on energy systems will hit underserved communities harder than other communities. But on the other hand, the energy transition itself provides a challenge. So this chart in front of us presents the reliability margins within New York City. The bars on the bottom, the red bars, means that we have sort of a deficiency in energy supply, and the blue bars demonstrate that we have enough energy. And what these charts demonstrate, and NISO provides these charts every quarter, what this particular chart demonstrates is that if the Champlain-Hudson Power Express doesn't come online by 2050, we're going to be deficient in terms of the energy we supply. That's given the predicted demands on the system and the if additional power plants become unavailable. So if the power line does come down from Quebec and we do get that energy, we'll be okay, but not after a 10-year period. You could see then it starts to dip below the line. Now, what does this mean? This means that our reliability is, or the reliability of the electricity system is threatened or is at risk. Next slide, please. The NISO is so worried about our reliability that it has postponed the retirement of 4 peaker plants to maintain the energy supply in the system. Now, peaker plants are those plants in the city that we use when we really need energy, when we really need the electricity. Typically, they're used during warm summer days. The reason they're turned on really quickly because what they say they ramp. They actually can generate power very, very quickly. It doesn't take weeks to get them up to speed. They could do it right away. The problem with peaker plants is that they tend to be dirty, if you will, because they use fossil fuels, and some of them use really sort of very sort of emission heavy fossil fuels. So what has happened is that the state wants to close these peaker plants, and they have mandated that they should, but NISO has pushed back recently and said, no, we can't do that because we have to keep the lights on. What's also interesting about peaker plants is that a lot of them are located in underserved communities. So those communities suffer from the use of those plants in terms of the emissions that they create. Next slide, please. Now, in terms of the reliability, when the lights go out, the question is who is affected? This map is created with Con Edison utility data, and it shows that where the lights went out in the city and where underserved communities are located. And if you look carefully, you can see that in many cases, like in the Bronx and parts of Brooklyn, the lights have gone out, and these are really in and around underserved communities. So as a group, the working group also looked at this particular issue, but we couldn't get the actual data on when the lights were out, when reliability went negative, but we found other data. Next slide, please. These data are from what's known as the 311 calls. So these are calls from residents in the city that claim that their power went out. They've been divided into quintiles, yellow meaning areas where there are very few, and red meaning areas where there was a lot of them. And we looked at the characteristics of neighborhoods from when these calls came from. And you could see that the higher quintiles tend to have a higher percentage of poverty in the census tract, a higher Black and Hispanic population, and a lower median household income. So what's actually happening is that during power outages, the least of us are the most affected. And with that, I will turn the slides back to Liv.
Great, thank you, Peter. So as Peter mentioned, there are challenges and barriers to the energy transition, and these have implications for human health and well-being. A concept that lends itself well to considering the wide-ranging implications of not meeting household energy needs is called energy insecurity. And I just want to note that this work is pioneered by Dr. Diana Hernandez at Columbia University. And again, this is included for the first time in NPCC assessments. So energy insecurity means being unable to adequately meet household energy needs, and about 1 in 3 households in the US experience this hardship. And there are 3 dimensions to energy insecurity. First, physical. So that's due to substandard built environments of the household. Second is economic. So financial burdens that high energy expenditures impose. And third, behavioral. So strategies to cope with the economic and physical dimensions of energy insecurity. So all of these are associated with environmental, health, and social consequences. And energy insecurity can be caused by high costs relative to income and or by frequent outages, as Peter just showed, which is again why this has to be a consideration in the energy transition. And energy insecurity matters because it affects our lives from the most micro to the most macro levels, like not being able to cook food or keep warm in your home, to making sure that your electric-powered medical device is reliable during a power outage. And of course, climate change is increasing and compounding the threats that result from energy insecurity. Next slide, please. So a household is considered energy insecure if they spend more than 6% of household income on energy bills. And you can see how those in the lowest 20%, so your very leftmost bar there, those in the lowest 20% of the income bracket are hit hardest. They spend about 9.6% of their income just on household energy. And if you count in fuel and public transit, it jumps to nearly 18%. Compare that to the wealthiest households, so the rightmost bar, where energy expenses are just a tiny fraction of their income. So that's only 1.3% for home energy and 3% altogether if you also include transport. That's a huge difference, and it shows the gap between the rich and the poor when it comes to energy costs. Next slide, please. So here's a diagram that shows you how energy insecurity functions as a pathway to disease and disadvantage. So we've been talking about health. We're trying to show here the connections between energy insecurity to poor health. So you can see here the 3 dimensions of energy insecurity that I mentioned. If you click enter, Janice, you'll see the circles pop up. Great, thank you. And how they lead to environmental, health, and social consequences. And there are, of course, external factors that lead to these dimensions, like neighborhood factors and social processes. And very importantly, and if you can click again, Janice, I want to draw your attention to the role of housing conditions. And this is a big chunk of our chapter because it plays such a major role. Next slide, please. So here's a closer look at how housing, energy, and health issues all lead to stress and therefore poor health. So as just one example, you can see on the bottom left there, so we can follow this physical deficiency using secondary heating equipment, which then leads to the economic hardship of high monthly utility expenses, which of course means higher total expenses. So now I'm in the middle oval here. Yes, thank you. And higher total expenses, which of course increases worries about the ability to pay various bills. And of course, that's very stressful. And each factor I want to point out can also have their own impact. So for instance, we know that the tragic Bronx fire in January 2022 was caused by an electric space heater. So that's an example of this very using secondary heating equipment leading to concerns, in this case, deaths. So not just health and safety, I mean, it led to the worst end. Next slide, please. So here are some key takeaways for the energy insecurity portion of the chapter. So energy insecurity can manifest in many different ways. So not having enough heat or cooling, poor indoor environmental quality, not being able to count on medical devices or keeping your medicines cold. So all of this can really hurt your health. And when energy bills eat up too much of people's budgets, there's of course less money for other essentials like doctor's visits or groceries, which of course also affects our health significantly. And most importantly, those hardest hit by energy insecurity are often those with lower incomes, experiencing systemic racism, anyone with existing health conditions, disabilities, and renters. All the people, facing injustices with personal factors, social factors that the health group mentioned as well. A lot of them, and also I want to point out renters who have less control over their indoor environments or access to resources like energy subsidies, which usually it's the landlords who have control over. So with that, I will turn it over to Jen. Thank you.
Thank you, Liv. So as Liv and Peter have started to allude to, we know that shifting over from a primarily fossil fuel-based system to cleaner sources of energy can impact future energy reliability as well as cost. And this is especially important to consider for vulnerable populations that we know are already more at risk from increased outages and energy cost burden. And so that will be a really important topic of consideration. We also know that climate extremes are expected to worsen over time, especially things like heat and flooding, and could amplify some of these impacts. So as one example, as extreme heat increases in prevalence and severity over time, cooling demand might increase and place additional strain on the grid. And heat in general can also impact grid infrastructure. So we know that equitable and just investments in policies that look at the intersection of energy and housing, as well as health, can start to help to reduce some of these health risks. Next slide, please. And so this is a graph from the New York Independent System Operator, or the NYISO, that looks at both historical and forecasted peak load over time. And so one of the major things that we see here is that around 2035 to 2040, they forecast that we will shift from a summer peaking system to a winter peaking system. And this is in part due to a forecasted shift over towards electric heating appliances. In addition to this, we see that for both the summer and the winter, demand is expected to increase in general. And so what this means in terms of shifting from a summer to a winter peaking system is that we'll start to have new considerations for outages that might occur during the winter that might affect how people are safe in their homes. So this will be potentially a new consideration as we start to electrify our buildings and shift over to this winter peaking system. Next slide, please. And so part of our report is outlining current and proposed both city and state policies, because the energy system is really statewide and even regional, but also, of course, impacts the city itself. And so some examples, there are some protections to prevent household utility disconnections. There are also different forms of financial assistance. So some things include utility bill subsidies, as well as reducing energy prices and debt forgiveness. There's also some programs that supply energy efficiency and weatherization assistance services. However, there's still documented insufficiencies with these programs, or areas where they could expand in terms of their outreach to eligible residents and households, as well as an expansion of funding in general for some of these programs and policies, and also expanding the types of measures that are offered through these programs. Another area of programming and policy is residential cooling, which the health group touched upon earlier. But this includes, first and foremost, for vulnerable populations, expanding the prevalence of air conditioning units for households that don't have a unit currently. Another area would be for households that do or don't have AC units, looking at shifting over to more efficient appliances, such as heat pumps. And then in addition to expanding the prevalence of air conditioning and also bringing in more energy efficient appliances, there's also an area that looks at reducing cooling demand This could be through energy efficiency strategies, through cool roofs, which is painting a roof white to increase the surface reflectivity and can cool down a building, as well as introducing green infrastructure that can provide shade and further cooling. And then there's also been policies that have been suggested, one by the city that would institute a maximum temperature set point for residents. And then other groups have proposed setting a minimum temperature set point for large commercial and office buildings. And then finally, there is another policy and programming area around instituting resilient and clean energy infrastructure. So some examples, and this is just a few of many, include large-scale energy storage systems. So this can alleviate some of the strain on the grid and reduce transmission bottlenecks and congestion, as well as smaller energy backup systems for multifamily buildings. Next slide, please. And then finally, we outlined some knowledge gaps and research needs that have stemmed from the other components of our chapter. So first and foremost, and really kind of an overarching knowledge gap, is the equity implications of electrification and transitioning over to renewable energy in the context of energy insecurity and health. So really looking at and investigating the distribution of how benefits and burdens are distributed throughout the energy transition will be a really key area of research in the coming future. Another area that Peter touched upon is that we have a gap in terms of household energy use and outage data. So Peter talked specifically about some of the gaps in outage data, especially longitudinal and granular data on where outages are occurring and why. So understanding the causes and potential hotspots where these outages are occurring could help to address them. And we know that utilities do have some of this data, but they're not required to publicly share it at this time. Another area that we've outlined and highlighted in our chapter is the health and safety impacts of dangers associated with both large and small scale batteries. So there have been documented fires in the state, not in the city, but of large scale energy storage, as well as within the city, multiple fires, I think in the hundreds in this past year, of e-mobility devices like electric bikes. And this especially impacts groups like delivery workers, where they're constantly using e-bikes. So this is another area that could benefit from further expansion of research into the causes and ways to address these safety issues. And then finally, another area that we highlight is looking at the impact of the expansion of public transit across the city on different socio-demographic outcomes, such as employment rates, educational attainment, local economic growth, and overall community development. And so those are just a few of many areas that we highlight in our report that could benefit from further research to fill some of these knowledge gaps in addressing energy insecurity throughout the energy transition. So with that, I think we'll turn it over to Franco for questions.
Thanks to all of you. That was really eye-opening. I'd like to sort of invite folks, of course, to answer, to put your questions in the Q&A, but maybe to start with a question by Karen, which I know was partially answered in the Q&A, but, you know, she's pointing out, you know, we point out these discrepancies in, say, for example, power outages, but which disproportionately affect Black and brown communities, low-income communities. But there wasn't much discussion about sort of energy consumption. And has there been some analysis of, you know, is there excess energy consumption, or are there ways of reducing the load and the potential for brownouts or blackouts by curbing sort of excess usage in some of the more affluent parts of the city? I was sort of struck by that image that you put up, Peter, that showed there were very few blackouts in Manhattan, whereas, you know, in the boroughs there were. So I don't know, I'm just curious about energy demand reduction and stratified energy consumption figures. So is there anything like that any of you can present?
Well, I think Tom mentioned this, and maybe I'll hand it over to Tom when he started talking about air conditioning and sort of the flagrant use of air conditioning in higher income households. I'm not sure of how to regulate that, but maybe Tom knows.
Well, before getting to the specific potential for regulation, I think there are a few facts about energy use in and around the city that are well established. And the first is that New York City, on average, has about 1/3 the per capita greenhouse gas emissions as the state as a whole. We tend to be very energy efficient in the household, residential, and transportation sectors because our apartments tend to be smaller than suburban homes. Your neighbors insulate you, and we drive much less. So there are resources. Some of these are cited in different parts of the climate assessment that note New York City's already a low carbon intensity. As far as wasteful energy use, I mentioned, overcooling in buildings being one thing that the city potentially could address. The city, I don't know if someone from the Mayor's Office of Climate and Environmental Justice is here, but the city has proposed a regulation to set a maximum temperature for residences, which already for many decades, the city has regulated the minimum temperature in certain types of housing that must be provided. So the city wants to do the same, recognizing the health risks of too much heat. Potentially, there are ways that the city could, I believe, set limits. Just a simple thing the city already does. It's illegal on a hot day to leave the front door of a commercial establishment open. To let, some businesses like to do that, let the cool air pour out onto the street to attract customers. So more could be done, I believe, by the city to limit excessive cooling use on hot days in large commercial buildings, other commercial establishments, and our large residential buildings in the city. We're building high-rise buildings in the heart of the city that some of them have average dwelling unit sizes of 7,000, 8,000, 9,000 square feet. So these are suburban-sized mansion dwellings in the middle of the city. And so they're going to, even if they're relatively efficient in design, they're going to use a lot of energy. So the short answer is, I think there should be ways that the city could ensure that the burden of conserving energy is equitably distributed in the city, and recognize the fact that our city, including some of our lowest income residents, are already living a very low carbon lifestyle compared to the average person in New York State.
Thank you. Another question, I guess, for again, inspired by Peter's figure there that showed the brownouts and blackouts in different parts of the city. What's the, if you ask the utilities, what's the explanation that's provided for the discrepancy in, or the sort of increased frequency of blackouts in certain parts of the city and not others? Is it, are there sort of bottlenecks in the energy distribution system that could be remedied, or is there something else going on that is worth talking about?
Well, that's a great question, Franco, and something that we could not get to. So what we identified were the 311 calls that had reported power outages, but we didn't know whether that was a grid problem, as you mentioned, maybe some sort of capacity issue, or whether that was like a housing issue. For example, just the apartment building, just went out because of the electricity system was old, et cetera, et cetera. And that is a really critical issue that we need to explore, to identify, exactly where the problem was. Now, there is something called hosting capacity. And when you look at the hosting capacity, and we looked at that in the city, the hosting capacity is the capacity of the system to take on more demand, if you will, at any period of time. And particularly, for example, to take on, let's say, EV charging. And what happens is that if you look at that hosting capacity, it's unevenly distributed, in that there are certain parts of the city that have much lower hosting capacity than other parts. The parts that, and not surprisingly, the parts that have the highest hosting capacity are Midtown. And when you look at the Bronx and parts of Brooklyn, they're much lower. So that could be part of the problem, but we are not sure.
Interesting. There's a question from Helena about, at this question about capacity. If the city were to provide ACs and energy assistance to every New York City household that is insecure, does that represent a significant burden? I mean, we talked a little bit about the sort of reliability issues that will be getting worse over time. And I guess related question would be, there's a lot of interest these days in electrifying. And is there a pace at which we would electrify too fast and get out in front of the, actually make the reliability issue worse too soon? I wonder if you could talk a little bit about, if any of you could talk a little bit about either of those points.
Well, I think that what's in the NISO is worried that we're getting, like exactly what you said, we're getting down too far. Like we're not ready. And their point has been, even if you bring the chippy down, within 10 years, we're going to need more. The demand will be, according to their projections, we'll have a lot reliability threats. So as we bring in wind, which we want to do, and as we increase solar, we're going to also need much more battery storage. And the amount, according to what I've read, the amount of battery storage we need and is not yet commercially available. So while we have planned for this, whether and how it's going to happen still remains to be an open question. And I think that's what we're seeing from NISO, that they're hesitant and they're sort of pulling back.
Interesting. Tom, you have something to add on that?
Yeah, I was just going to say, the other sector where I think there's both an equity and a reliability issue is transportation. So if you look at the distribution of subsidies for the purchase of electric vehicles and home charging equipment, that disproportionately has and likely will continue to go to more affluent suburban communities. In the US, we're allowing and subsidizing very large battery electric passenger vehicles to be built. They take a lot of energy to charge. They become less efficient in the wintertime, which is when, as Peter was describing, the peak energy demand as we electrify heating and transportation will shift from the summer to the wintertime. And that will occur at the time of year when solar of any sort will be producing the least amount of energy. So raising these issues is not a way of saying, we shouldn't be decarbonizing, but it's acknowledging some of the very real challenges. And, from a health and equity point of view, making sure that the burden of issues with reliability or with cost does not fall on the low, poor and working class New York City residents who are already, I would say, I mean, this is my own opinion, this is not an NPCC position, but are already doing their share, by and large, to live whether they intend it or just they like living in the city or need to live in the city, they are living a relatively less energy intensive lifestyle than the average resident of the state.
Because there's a question by David about the use of technology. And I'm thinking that this is probably referring to sort of smart energy controls, smart temperature controls. I mean, we're talking about sort of how the larger grid is sort of clunky. It sounds like there are parts of the city that go down. In that context, what's happening in terms of the use of sort of smart meters, smart energy consumption, AI technology in trying to kind of regulate things so that perhaps we have we have better reliability? Is there, or is this just a supply and demand question, and it's limited opportunities for sort of decentralized modifications and controls?
I think that the AI has certainly has advantages, or it's being thought of as providing benefits in terms of reliability and lower energy use, et cetera. So for example, if you knew what the price of energy was at any time, you can decide on, for example, when to turn your washing machine on. That would be what's called a two-way street, where not only do you demand energy, but you could actually receive information from a utility on the particular cost. And sort of to get that information out would require sort of changes in how the system is set up, so that we can advance that AI technology. Or when, you could actually, extrapolate and say, well, if your apartment was too cool, you could actually turn it off, like, or sort of, turn off the air conditioning. That is possible, certainly, but not immediately. I think the New York system would have to be, significantly restructured to allow for that. And on the other hand, that type of sort of interconnection, integrates things, but with that integration is, brings more risk, cascading events. One thing goes down and, a lot of other things go down. And I know that you yourself, Franco, know a lot about cascading events. So I do see that also. It is a double-edged sword.
Great. And we have a question from Clement about alternatives to battery storage. And I'm just curious, it sort of makes me think about a bigger question of whether in a place like New York City, renewables in general will definitely increase the need for battery storage, or is the grid sort of big enough and robust enough that the grid itself could provide that storage? But I wonder if you want to say anything about needs for storage and batteries and related issues.
Well, I think the NISO has come out and said that, they're called DEFRs, right? Dispatchable energy, free emissions-free resources, like whatever form they are, and we're going to need a significant amount of them. I'm not sure that hydrogen right now is a commercially viable solution for that. So, I thought that was part of that question. But, we're going to need lots of storage. And we're going to have to figure out how we're going to get that, and how that's going to be distributed, and where it's going to be located. So we know that lithium batteries have problems, if they're overcharged, we have fires, et cetera, et cetera. And the argument is that if the batteries were standard and they were, they were bought under controlled circumstances, and they were treated under regulated conditions, that wouldn't happen. But there have been fires, Tesla had in California, they had a large battery facility that went up in smoke, and that was like September 2022. So, they're not necessarily without risk. So these are all like things that have to be thought about. I guess not that I guess, I know that part of what the chapter was talking about, the energy and insecurity chapter, is that, we have to be deliberate about our energy transition. We have to think about this carefully and prioritize the least of us. So if they are safe and they are, and energy is available to them at a reasonable cost, then we should move ahead.
Great. Tom, I see your hand up. Did you want to add to that?
I think this is covered in the energy chapter, but there is a type of solution, partial solution for multifamily buildings that would provide rooftop solar, limited battery storage as a backup to help with sustaining essential functions in the building, like people with life-sustaining medical equipment to be able to recharge, maybe power a refuge room that would be heated or cooled, that sort of thing. So not trying to fully store enough energy to fully energize the building, but to provide some essential energy services. And there's an example of a building in New York where that's been demonstrated. So that's another, an example of how to make sure that there's at least enough energy to keep people safe when there's a limited outage.
Great. Thank you so much. Well, I think we've gotten through, I see Carl's question is being answered by Tom separately. We've gotten through all of the formal questions. Maybe we could invite the energy team back on and see if there's any sort of discussion that wants to happen between the two teams. If the health teams have any questions for the energy researchers and vice versa. We do a sort of final round. These have been really complimentary presentations. And one of the things that I thought, there was mention made about housing, and sort of how poor housing or challenged housing in some way can lead to stress, which can lead to power outages, lead to stress, lead to health. And it just strikes me as that's something that kind of is cross-cutting even for flooding. For example, if your house is in a location that floods frequently, then you have more stresses. All of these issues are in some ways interconnected. And, we had to have this series over 3 months, but anyone who has sort of questions, cross-cutting questions, we can have a general discussion now. All right. Well, if there's none, we'll go to our last slide. This is just upcoming. This is just a review of what we just did. January was, and these are all available, as I said, on the CC Run website. In January, if you're interested in the climate projections for New York City and the flood risk results, that's recorded in the January presentation. The demographic changes and equity was in the February recordings, and then this one will be posted within a week or so, the health and energy implications. And please do, so let's see, is this, this is just showing you where all of the previous NPCC reports will be presented and or are already posted, and this report, this sequence of reports, is going to come out in April. And my last little pitch is Hurricane Schwartz, who's a weather reporter, will be with us to talk about climate change during the April version of this series. So feel free to come back and join us at the first Wednesday of every month. But one more round of thanks to all of our speakers and to Janice and the NPCC team for making this sequence happen. And of course, we couldn't have done it without Nikki and all her support on the back end. So thanks to all of you, and we'll see you next month.